Hi, my name is Amy. Welcome back again to Health Focus. And when you see me alone, know that it's the session for learning everything about quality. Everybody who knows me knows that I'm so passionate about quality, and I want all of us to be passionate and implement quality in every single facility that we work in. Every single facility you visit, just tell them, we need to do this in quality. Every single place you go for an interview, look around and see if it's offering quality services. And hence today, that's why our topic is on learning. You are so much welcome. And again, let me ask, have you subscribed? Have you liked? Have you shared? Join the family of Health Focus and let's learn together. Welcome. Now, there are questions people ask themselves when you have been appointed as the CEO or director, or you are the quality lead, the quality manager, quality advisor, quality officer in an organization in healthcare. Where do you start? You are the board member trying to say that we need to put quality in this organization. Where is the beginning point? That's the main purpose of creating this video. In healthcare in Kenya, specifically because that's where I'm based and that's what I know, we have various standards in healthcare. We implement, number one, we have Kenya Quality Model of Health. That's a standard derived from Ministry of Health and implemented in the country. We'll talk deep about it. We have a standard called Safe Care. It's a standard from Pharma Access, and it's also rolled out in Kenya and it's being implemented in various organizations. We have Joint Commission International. It's another standard implemented in some hospitals in Kenya. We have a standard called COSASA. It's a South African standard. Again, some hospitals are accrediting themselves with this standard. So with all this list of standards, I want us to measure in one and walk through it through the journey until the end. The next video will address another one. So I would like us to start with Kenya Quality Model of Health. That is KQMH. KQMH is a standard that was developed by the Ministry of Health back in 2001, but it has gone over years to be reviewed, and the latest review was done in 2018. So in 2001, Kenya Quality Department developed a Kenya Quality Model of Health standard to be implemented in the entire health services in the country. This standard has undergone various reviews, and the latest is back in 2018. Why was 2018 review necessary? Is because there is Kenya Health Policy 2014-2030 that was put in place. Another thing is the WHO current pillars of health consideration. Another thing is initially the context of this KQMH didn't consider the clinical context. It basically had facilities and 5S methodology implementation, and much emphasis was not put inside when it was doing clinical work. So with all these things, the review was done in 2018. And for further knowledge on what was reviewed, you can get that standard. It's online, it's free. But if you need help in trying to implement it and put it in place, there's so many people who can help you out. But again, I say I'm here, I can help you out. So what does this standard consider? It considers the principles of quality. And again, I forgot to say that all these standards, their main goal is to ensure that service delivery is done in a safe manner and in a quality perspective. So the principles that I put in place in the Kenya Quality Model of Health, just like all the other standards, are the leadership, are the customer orientation, that's both external and internal. Then we have involvement of people and stakeholders. Then we have the system approach, that the way the work is being done is done in a very systematic manner. We have process orientation, continuous improvement, and finally, evidence-based decision making. Let's come to the breakdown of what is found in this standard. What quality parameters or what quality dimensions does this standard put in place? They're in a total of 10. This standard, when you want to implement it, has factored 10 areas. The first area is in leadership. How leaders are doing their work in that facility and everything in totality, and governance. Then we come to the human resource perspective. How are staff getting into the facility? How are they checking their certification and accreditation to perform the service? Is their service delivery safe, and all those things? Then we come to policies, standards, and guidelines. How they're being documented, how they're being standardized, and all these factors in place. Then we come to the facility and infrastructure, supplies management, equipment, transport, referral system, health records and health information management system, and then finally, financial processes. If you run a health facility and these things you are struggling in putting them in place and you're wondering, how do I put the house in order? This standard gives you the bare minimum requirements that you need to put in place. You also need to have some processes documented and processes implemented. The areas that you have to factor that processes are in place are as follows. You must have outpatient services getting a process, then patient-centered care, infection prevention and control, outpatient services, accident and emergency, surgical emergencies, anesthesia, safe delivery, neonatal care, dialysis services if you have, laboratory services if you have, pharmacy, radiology, and finally, mortuary services if you have. As you can see, initial standard didn't factor all these clinical areas. But right now, the KQMH will give you the ability to have all these processes in place. Finally, what quality standards don't miss is objectives that measure that what you're doing is meeting the desired standard. So at the end of the day, results are measured against the set indicators, and you are able to track the performance of each areas that we've listed above in the Kenya quality model of health. How do you measure? How do you audit a place and finally say that this place has met the KQMH standard? The scale is 0 to 3. When we talk about 0 is there is no document, there is no effort to put this standard in place. That's where we give you a 0. When we say 1, the standard is partially met. There is a standard in place, but implementation is not there. Or you're implementing this thing, but there is no standard written in place. And then finally 3, which shows that you are fully compliant. Then we have the dimension of how to say that you've performed well or you've not. We have 0, which says that you have more than 75% of the target. Then we give you 1 if you have 75 to 50% of the target. And then 2, when you have 49 to 25 of the target. Then 3, when you have 25 to 1 of the target. And 4, finally, when you've met the target. 4 is the highest. It means that you are doing so well. When you have 0, it means that you are really below the 75% mark. That's all about the Kenya quality model of health. The next time, look out. Maybe you're going to talk about the standard you really want to learn about. For more information on how to implement, kindly contact, comment down below, and then we will get back to you. Thank you and God bless you.